Your one job as a parent is to protect your children. And so, Alyssa was diagnosed with leukemia on a Monday afternoon, and she died 10 days later. You do not die of leukemia in 10 days. She died of medical errors. She got a hospital-acquired infection with a C. diff. There was a boy in the room next door to her, and this hospital, they shared bathrooms, and he got C. diff and died, but I didn't find that out until months later. She became septic, but they had ordered lab tests to look at this, and when the lab tests came back, they showed there were critical values, and no one acted on them. They did last rites before she went into surgery. And to sit there and think, you might not get your child back again. But she came out of the surgery, and it was then that they told us there's nothing they could do. She died a painful and a horrific death. One of the hardest things, it's the loss of hopes and dreams. What would her future have looked like? What was her career? For so long, I couldn't take a family picture because I couldn't have that missing piece. I fought for years to try to get answers. And that is inhumane to treat someone that way after you've had a loss. And it took the organization 3 years, 7 months, and 28 days to meet with me and have the first real honest conversation. And one of the biggest gifts anyone can give us after a loved one's been harmed is transparency. The first thing is tell us what happened. The second thing is take accountability. The third is I'm sorry. Those words are so powerful, and if they're genuine, I don't know anyone that when they've heard them just doesn't break down and cry. The fourth is tell us how you're going to fix the problem. One of the things we need to know is if we've lost a child or a loved one and we know it's happened again, then it's like their loss was in vain. But the fifth one that I think is becoming more and more important is let us be part of the solution if we want to be part of the solution. And for a couple of reasons. For some people, it's a way to know the problem was fixed. For others, it's a healing factor. And for some, it's a way to honor their loved ones.
Three years, 7 months, and 28 days. That's how long it took for this family to get answers. As a mother, I cannot imagine the pain and anguish this must have caused. And as a healthcare professional, I know that hospital-acquired infections are preventable. Errors such as this don't happen because of individual mistakes, but rather because of deeply rooted system and process problems that must be addressed if we're going to prevent other families from experiencing this same pain. Now it is my privilege to introduce our next segment, where we asked hospital executives to share what they've been doing to address these issues in their organizations, both here in the U.S. and internationally. My first question is to Chuck Holland, a hospital CEO from Chicago, Illinois. Chuck, what have you done in your system to bring person-centered care to your patients and families? And how have you prepared your staff for the shift from clinician-centered care?
I think importantly, we've built a patient family advisory council that challenges the hospital on what we can do better. We've also opened an ambulatory care center that's focused on a one-stop, customer-friendly approach to our outpatient services that was a much-needed service to the community, focused on prevention and wellness. We've also established employee service excellence teams that focus on setting standards for patient care and recognizing employees for attention to patient needs. To bring patient-centered care to our staff, we train our staff using peers as trainers on the importance of service and quality care to patients, their families, and the community.
Thanks, Chuck. Wow, what great work you're doing in your community. It's critical that social disparities are addressed in order for hospitals to truly provide person-centered care. Now let's hear from Dr. Wayne Sheu,
a hospital superintendent from Taichung, Taiwan.
Dr. Sheu, what has your organization done to shift from a clinician-centered culture to a patient-centered one?
We have promoted patient-centered or called holistic care as one of our core values in the hospital for decades. In reaching these goals, we had constantly offered training and sharing education, promoted quality improvement circles with annual competitions and learning, engage in smart and convenient services process by applying new IT technology. We also encourage behavior changes to practice, for example, using one of the mutual communication way called shared decision making, and most importantly, to cultivate the patient-centered concepts embedded in daily work in the hospitals.
Thank you, Dr. Sheu. Shared decision-making is definitely necessary to shift to a more patient-centered practice. And finally, let's hear from Dr. Antony Staines from Purley, Switzerland. Dr. Staines, you're a former hospital CEO who now leads a regional patient safety improvement program. What do you think that organizations need to do to improve patient-centered care?
In my experience, it makes a tremendous difference in terms of safety if the patient is involved and engaged in his or her care. But to be involved and engaged in his or her care, the patient must get the right information, must have opportunities to discuss that information, to discuss alternatives, and also it's important that the patient adheres, is in agreement with the care that he or she receives. I believe it can be very dangerous if the patient doesn't understand the care that he's getting or she's getting, or if the provider believes that the patient is in agreement when in fact he or she is not. Another thing that is important is understanding what matters to the patient, because that's the way to provide the right information, the information and the solutions that are customized and compatible with the person's situation, preferences, and values.
Thank you, Dr. Staines. That's excellent. What matters to the patient should absolutely be our guiding principle in providing safer care. My next question is about continuous improvement in healthcare. One of the reasons that so many hospitals struggle to eliminate errors is because we've historically worked in department silos rather than viewing improvement from a system level. So, Chuck, what has your organization done to eliminate such silos?
I think during this period of the pandemic and the unrest throughout the country in addressing institutional racism and the systemic racism that's throughout our society, our hospital has done some soul searching as well around the whole issue of racism, and we've done education with our staff and reinforcing how systemic and institutional racism has an impact on health disparities, which is a huge issue in our community and on the south side of Chicago. Tangential to that, we also emphasize reaching outside the walls of the hospital to address social determinants of health. So food as an issue, housing as an issue, violence and disinvestment in our communities. We've partnered with the Chicago food banks to provide food for the community. We have been the sponsor of an affordable housing project in the community to provide affordable housing opportunities for the community. We're totally invested in community development as the community's single largest employer. And we're also involved in the city, in particular on the city's Racial Equity Rapid Response Team that's partnered with other providers in the area to really address the whole issue of racial equality and and the disparities issue that we all face in order to address healthcare in a more comprehensive way.
That's great, Chuck. I love how much of a focus you have on involving your frontline staff. That's definitely key to eliminating silos. Dr. Sheu, how about you? What has your organization done to improve collaboration across disciplines?
We have implemented reorganization, education training to eliminate the silo effect. For example, not only executive levels have regular terms, but also administrative employees regularly rotated to work at different departments. We regularly invited outstanding outside speakers to share their experience with us. We believe that having physicians engage in quality improvement are critical. We particularly welcome those activities in the areas of cross-discipline, collaboration, and communications.
Thank you, Dr. Sheu. You're so right. Involving physicians in improvement work is absolutely critical. Dr. Staines, what thoughts do you have for us on this?
Well, care is a word that we use in the singular form, but in fact, there are many plural aspects in care. Care comes from different sources, from many carers and many providers, and from the patient himself. And to work safely, all of this has to be coordinated and work as one system. That's what we call care integration. And when care is not integrated, well, there are duplicates, omissions, delays, inconsistencies, and that can be very disruptive for the patient, frustrating, sometimes depressing, but often harmful. So what can be done? Well, teamwork can be used, structured communication, information systems. Team medicine is so important to produce care integration. And if the patient can get involved in his or her care, he or she can contribute to integration through his or her questions and help coordinate and integrate care.
Wonderful. Thank you, Dr. Staines. I love how you reinforce the importance of structured communication and the use of information systems and breaking down those silos. Well, thank you so much, gentlemen, for sharing your insights with us as we all continue to work on continuous process improvements within our healthcare systems. I hope you stay safe and stay well.